Getting into another conversation that we'll have this morning. Just before that, CT. And one of those issues is a healthcare system which is botched. Okay? Yes. Now, if you are dealing with a healthcare system that is not working today, the payment will come in the future. So you must do everything that you can at the moment to make sure that it is working and it is working well. Now, it seems as though every day there is a new healthcare issue. There is a problem. Whether we are saying that you're going to not renew licenses for private hospitals, whether tomorrow you're going to say that the system is not working, whether the Auditor General is going to come out and say that the system actually belongs to individuals and that she has no paper. She has no documentation, no proof to show her that it is actually a government-owned entity. Whether it is doctors, whether it is clinical officers, whether it is nurses who are saying, you know what, if you guys didn't do what you said, if you don't do what you said you were going to do, we're actually going to shut this thing down. Clinical officers, nurses, actually, I read, we don't have enough doctors, number one, in Kenya, okay? Number two, when you go to hospital, the majority of people who see you, it doesn't matter. It doesn't matter, especially if you're going into the public health system. The majority of people who see you first are clinical officers. Clinical officers have already said, well, if you realize they're important, you don't sort us out, we're going to get to a place where we actually will, again, down our tools. Health workers are saying there's a strike threat, and it's not a threat. It's actually something that will become an action. As Shah warns of fake payment list, I mean, it doesn't get any better than this. Let me give you that information, okay? Just when you thought it was safe to get out of the water, CT. Health workers have threatened to go on strike if their demands for better terms are not met. During a demonstration yesterday, doctors, members of the Kenya Union of Clinical Officers, and staff hired under the Universal Health Coverage Program called for remittance of statutory deductions and payment of salary arrears. Now, statutory deductions mean that at the point of pay, money is taken. It's supposed to be put somewhere. Now they're saying they can see that those deductions have not been put in the somewhere, as well as their salary arrears have not been paid. They've also said that interns posted and the UHC staff put on permanent and pensionable terms. Do it, and do it now. In that march that has started at the Kenyatta National Hospital to the Social Health Authority offices, Afia House, and then the Senate, the health professionals warned that they would shut down the healthcare sector in May if they are not heard. And not just heard, but it must be done. According to the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, Lydiah, we are ready to go on strike, not just for ourselves, but for interns, clinical officers, and UHC staff. This government has decided to kill both patients and doctors. So, it's true. Yeah, if the system is not taking care of the patients, and the system is also making sure that the doctors who are offering this care are not taken care of, what are you doing? You're killing the goose, you're killing the egg. Yeah. He condemned Shah's failures, stating that even basic health services remain inaccessible to many medical professionals. There is a story that we read this morning about a doctor who works in Kenya's level 6. One of Kenya's level 6 hospitals is in Kenya International Hospital. Page 7 of the Standard today. He died. Why?
300,000 shillings bill only could do 30,000.
Exactly.
Shah could only pay for 30.
Did he die?
He died.
Yes, he did. Did he die as a result of complications of his illness?
He died pretty much because he couldn't afford healthcare.
Stress became an issue for him. He is now, if the people who are offering the care are actually not even being able to be taken care of, that's a big red flag. Questions that you have to ask. Shah is only working for politicians, according to Lydiah. Healthcare workers cannot access it if every 9th of the month. This is unacceptable. The protesters also decried plans to slash their salaries with concerns that their pay could be reduced from 70,000 to 40,000 shillings, despite Ministry of Health budget standing at 3.7 billion. The health workers cited frustrations with contractual jobs that leave them earning far less than their county government counterparts. Okay. It does seem that there's a lot of pontification going about when it comes to Shah. And it's unfortunate. It's low-hanging fruit when you want to take a stab. That in too many areas, it's just not working. That we started to see the rumblings from the ground and it started to go up from people, whether they registered or not. Also, it's misery loves company. So you tell me, Dennis, it's not working. I can also tell you, actually, no, it's true. It's not working. Yeah. Whether I've registered or not is really not your problem. But I've told you it's not working. Then we start to see the realities knock on our door in the morning. We see that this is actually the case, that it is not working for so many, very, very many people who have tried to access it. And then when you have members of your representative body being Parliament, whether it is at the Senate or whether it is at the National Assembly, then we have a problem. And the cry continues to be from people across board, partisan or not, to government, that, you know what, guys, at the very least, this system ought to work. It is one of the things you rode on to ensure that people would actually get treated, and that once they delivered, they could. Why do you have 18 million people registered and only 4 million people are paying? What's going on? What's happening? Why are people not paying for the system? Is it because it's not clear how their money is actually going to work for them? When people go to hospital and actually the system says, okay, fine, you have a bill of 400,000, we can only pay 17,000. In a system where you told them that they would be able to go to hospital, present their credentials, they would be able to be sorted, taken care of, and they don't have to pay a penny to come out. What happened? Why are we still dealing with a situation whereby we were told everything was going to be okay, and here we are, and it's still not okay? The practitioners around the system are telling you, we can't do this anymore. We'll go on strike. The thing will be crippled. In a month, we could be staring down a situation whereby you're going to go to hospital. It can't happen. Private hospitals say you owe them money. They're not going to offer you services. Faith-based are about to join the fray. My goodness, it's a tailspin, and I'm dizzy.
You see, when you talk about even let's talk about 18 million registered and the 4 million. What is if the 4 million that are paying because they are they're earning a salary which is deducted monthly on a monthly basis. When you talk about the deficit, that is 14 million people who are registered, how is the government ensuring that they are deducted as registered members of SHA? That is not clear cut on how the government is getting the monies from them. And as we talk about this system that is here, it is here whether we like it or not. Kenyans are seeking medication using this system. And the government has no option but to make sure that SHA is working and is working for everybody. Like you say, whether I'm registered or not, if I hear it's not working for Ndu, I will carry that gospel forward. Of course.
Yes.
You know, because it is someone I know that it has not worked for them. But what is the government doing in fixing all these issues associated with SHA? Because you see, doctors are saying one of our own died because SHA did not come through for them. Many other Kenyans are singing the same language. The only people who are saying SHA is working are the people who do not even use SHA, because we know members of parliament have 10 million shillings private insurance.
Do you think that the burden on government is too heavy, City? And let me before you take that breath properly, maybe it is a lot. Maybe there's not enough money. I mean, Director of Medical Services, Dr. Amoth, has said, you know what, we need to make sure that people are paying, because if they don't pay, we're not able to pay. We can't pay. If people don't pay at their tier 2, remember tier 2 is when you go in and that money that you pay is actually your money. If they don't have enough money, then it is not possible. We can sing songs and craft tales and do whatever we want, and we can pontificate from here until dusk. But truly, if there's no money to do the thing, it's not going to happen. If there's no money to pay health workers, it's not possible. By the time somebody's saying we're going to slash your salary from 70 to 40, is because there's no money. Leave alone that there could be money for other things, okay? Yeah. But what we are saying is that in this case, where they need money to pay medical doctors, they need money to pay clinical officers, they need money to pay nurses, they need money to pay interns. If there's no money, it's also...
What we do in such a situation is, first of all, let's start with what was the Ministry of Health allocation for the financial year?
3.6 billion.
No, it was more.
Okay, let's go with 3.6 billion.
Can the Ministry of Health give us an account of how that 3.6 billion was actually utilized to meet the needs they have? I ask this question because before you convince us that the money was insufficient, it's the same question we've asked of counties. You say this money is not enough. Okay. Tell us the shortfalls, but also tell us how it is you use the money that you are given.
So, based off information I'm seeing here, the health sector was allocated 134.437 billion in the 2023-2024 financial year.
Yes. Yes.
134 billion.
134.
Yes.
Yeah.
Yes.
Low.
Yes. So, just simple. Do the maths. Break it down. You know what you spend money on, isn't it? You know the budget line, don't you? You know the items for the ministry. Just show us. That 134 billion, this is how we used it. And this is where the shortfall is.
Yes.
Now, so long as you can't document and show us, don't talk to us about the shortfall. Don't say there isn't enough money. That is a tired, trite story. It is banal. It is something that, yes.
No, carry on, please. Keep going.
Please carry on, yeah. Drop them.
Mm-hmm.
You cannot speak of one without explaining and documenting and detailing the other. Okay? Now, this conversation about there not being enough money.
Not enough. None.
Take it somewhere else. Take it somewhere else. If you're going to talk about money that was allocated and budgeted for but didn't arrive, talk about that one. And also tell us how it is you utilize that one. If you then say you prioritize certain things, explain why you prioritize those things and didn't prioritize the human resource who are supposed to make these things possible. And I'm talking about cross-board. Are the people within the Ministry of Health that got paid? Yes. Are the interns under the Ministry of Health? They are, yes. The service they provide and supposed to provide, is it crucial? Yes. So, when you talk priorities and crucial, put those two together. How then should the money have been allocated? This is a tired story. Tired. We are chasing a tail that doesn't even exist. We're talking about a black cat in a black room. The black cat doesn't even exist. Where do you take the money that is allocated and what do you do with it? Forget these long stories. When you have that budget, we are talking about public or the public health component, the primary health component of SHA. We're talking about the critical and emergency care that is supposed to be the third, where the government is supposed to bring the funding. Explain to us, when this budget was given to you, since you're the Ministry of Health, how much of this money went into these two sections? I mean, these questions keep coming up and they must be responded to. When they're responded to and it equals, we cannot pay interns, we'll understand. If they're responded to and it answers, we cannot honor the CBA, we will understand. But so long as that maths doesn't math, okay?
Well done.
Then take that discussion somewhere else, okay?
Yet here we are, City. It is what the government is saying. They
No,
do not
it is. The information of the government is piecemeal. You tell me a statement that you could consider comprehensive that was issued regarding this matter. Tell me which one. As a substantive office holder coming and saying, this is this, this is this, this is this.
No, unfortunately, we haven't. And what we've gotten in terms of a response to this is the threat that perhaps we can shut down, licenses for private hospitals. That's the answer. Kind of like what we see with the math problem that we talked about earlier in the morning, is that if there is a problem, we want to solve a problem by covering, there's a crack in the window or the little part of the window that's chipped. And rather than removing it and replacing it with the new glass,
you put in a cardboard.
we take a cardboard and cover it.
Yes. So it's like the window doesn't exist.
Yeah, so if I don't have to see it, then the problem doesn't exist. So now, if I can revoke your license as a private hospital, then I don't have to deal with the fact that I owe you 30 billion shillings. And I don't have to deal with the fact that this thing is rotten at the core and perhaps we should dig out the rot and deal with it. So I cover it up with the cardboard and I move. So if I don't have to deal with, okay, so fine. Math has been a pain point for students in school. Instead of sorting out our teaching methods, instead of insisting that the trickle-down effect is actually, it's streamlined and that it's working properly, and then I'll say, okay, fine, you don't have to do it. You see, that's how we're starting to deal with issues. And then we say, okay, you know what? At the county level, if health workers go on strike, what are we going to do? We're going to sack you. Okay? And we're going to bring other people in. There are many people who want jobs in this country. If you think that you're going to insist on us to pay you with money that we don't have, we're going to get rid of you. Okay? That's going to solve the problem. Then we're going to bring others into an already source system, and then we're going to think we can solve it that way. I have a problem.
In this same ministry, are you telling me that the travel budget has been cut? Are you telling me that people who work in that ministry don't travel? Are you telling me people in other ministries don't travel? We heard of austerity measures.
Yeah.
One hears it. What does austerity measures mean? It means the business that we had as usual can't be. Unless it's critical. Now, COVID taught us you didn't even need to travel. You can actually meet those people online and chat and conclude. And then take the two people who need to sign to that country to sign, or ask those guys to come over so that we can sign. The options are plenty. The story of austerity is precisely that. The areas where you see austerity, the areas that you don't. If I saw government services grinding to a halt in all sectors, and others, essential or non-essential, grinding to a halt, then I would say, this money problem is real. That is not the case. We still have the Director General pointing to us glaring and obscene amounts of money being spent
on travels.
Yes, and by the same government officials.
The same people.
Help us understand this austerity is what
But
exactly?
what is our problem? No, honestly, no. No, sorry, Aseto. What is wrong with us? Because is there something wrong? Because I saw a comment by somebody earlier, and I think it was my take, who said, honestly, what happened to us after, is it after independence or even before? And it's not just Kenya, by the way. What's wrong with us? What's wrong with us?
African countries have this problem.
Yes.
Some are worse than the others. And then you know what we do? The bar is now set on comparing ourselves with the worst.
Yes.
How can that be a bar?
Honestly speaking.
That's a pit. It's not a bar.
I think about the country, my country, Nigeria. I think about the country and I think about those that surround us and say, what really is wrong with us? That what is available, you think that the best thing that you want to do with it is take it and put it in your pocket. That you think that the best thing that you can do when you look at a dilapidated economy and you look at people who are suffering to stand up in the morning and make it from point A to point B, to suffer to take their children to school, to get on public transport and get home, to suffer to have a meal a day. And you think that the best way to deal with it is to steal the money and to prioritize that money for something else. No, there's something wrong with us, honestly. And I think that's what we need to be dealing with.
Yeah.
And I go back to that. What value do we place on human life? What value do we place? Because if our value index was at optimum, you see all these things that we complain about, that people say we are making too much noise. This thing we talk about education, shouting like mad people. This thing we talk about health, shouting again like even madder people. You talk about a road that has not been made for 20 years. If our value system for doing the right thing, if our value system for putting people top in terms of priority, if our value system for the job that you've been given to do, you do it right. If our value system, the points were up here, in fact, we would not be having anything to talk about.
You see, when you talk about our value system, let me just paint a picture. I was with Dr. Samuel Mwenda over the weekend, and let me just paint a picture of what it is we're dealing with when it comes to matters Sha. If you go to Tenwick Hospital today, they conduct around 3 to 4 open heart surgeries weekly, because that is their specialty. So that means if you do not have money, that patient who does not have SHA is not working for their benefit, they will not be able to get these surgeries done. And if they down tools today or they ask you to bring the money, that means around 6 people will not be able to get these services. Now let's go to Kijabe. Kijabe is well known for all the surgeries they do. They have 15 well-equipped theaters that attend to Kenyans every single day. We're talking about individuals who are seeking critical care in this country who cannot be able to access these services because the government has decided not to pay these faith-based institutions for reasons well known to them. We're talking about people who have conditions that are life-threatening. What value are we placing on human life? And the Daktari said, it is simple. If the government does not pay, you as Ndu, if you come with your heart condition and you need a surgery, I will tell you, the government has not paid me. Please give me $1 million bob to be able to operate on me.
But even it goes beyond payment, because usually this thing works, it's credit that the hospitals give the government. So they've provided services and they haven't been paid, and they can't see why they should continue going to the hole. Yeah. But this one we've discussed. I want us to touch on press freedom for the next 5 minutes.
Mm-hmm.
Okay.
Go.
Because it's important. Let me just read it.
Yes.
Press freedom refers to the rights of individuals and organizations to express, publish, and share information, ideas, and opinions without fear of censorship or government interference. Mm-hmm. I'm just going to repeat this so that you understand it.
Okay.
Press freedom refers to the right of individuals and organizations to express, publish, and share information, ideas, and opinions without fear of censorship or government interference. It is a fundamental component of democratic societies, allowing journalists and media outlets to investigate, report, and criticize freely, acting as watchdogs over government actions.
Okay, so after you've read that, number one question is there a practice of ultimate press freedom happening in Kenya today?
Ultimate? Nope.
No. And why would you say that?
A lot of our revenue is closely tied in with government. It's a policy that we have, and it's normally meant to be given to the either of the 3 big media outlets. But in our case, it's not just a question of the media doing business with the government. what is at the center of any discussion is what the government owes the media.
Yes.
And it's the same story where the government pays, and they have paid.
Yes.
We have been paid some money, but what is owed is a great deal more.
Yes.
So it's more or less being dangled. And it's like you're being told, if you do not do what it is that we consider to be appropriate, even this we will not pay. When you get to a point where a contract that has been signed, you're being told, this one, no more business to you. Okay. How do you interpret that? If it isn't as though you are being told, if you do not do what we think you should do, then you will not be doing business with us.
And essentially doing what you think we should do is making sure that the headlines that you're putting or the stories that you're carrying across your media platforms essentially are cushy stories, and that what they do is that they're comfortable, they're cushy, and that you make sure that, you know, the powers that be are aligned and that they're comfortable. The question also is that what position does the media hold as the fourth estate?
Yes.
What position does press hold when it comes to telling the truth? You know, there's fact and then there's truth.
Yes.
When you share somebody's opinion, when you put it in the headlines, refute the story. Can you refute the story? Refute the story. If there's nothing to refute, if there's nothing to refute and it hurts your feelings, then, you know, all we'd have to say was, you know, if it hurts your feelings, then perhaps that's something that you need to do and look inward.
Yeah.
Or inquire.
Or ask other people if they also feel
or
that
even inquire the very people who aired that particular opinion, ask them to explain further. Secondly, that freedom doesn't protect you from defamation or having content that is illegal and that is false. It doesn't.
Yeah.
It has to be responsible freedom. Yes.
Yeah. And you see, even when you talk about media freedom in this country, dissent does not mean disrespect. When you're being critical in reporting, it does not mean that we are infringing on your right. You're telling us this, we are asking the tough questions that perhaps you don't want.
Oh, we're telling you what you said, this is what it means.
This is what it means.
Or this is how people have taken it.
Yeah.
This is what people actually see. When you stand atop vehicles and do your tours, when you have a health system that doesn't work, when you form a pact with individuals who you think that now this is the panacea to Kenya's problems, this is what Kenyans are actually telling you that they think about what you've done.
Yes.
So do you take the position and decide you're going to do something about it if you care? Or do you say, actually, you know what? You who is bringing out this information that you would actually use as prescriptive by Kenyans, what we're going to do is we're going to say that maybe we're going to make it a little bit more difficult for you to operate.
You know, we are a news and information and data gathering outfit. It's what we do.
It's what we do.
And we represent what we have heard. And we say, this is it.
This is what people have said.
Yes, this is it.
You report on the news. You don't conjure up your own opinion. That's why you have op-eds in the paper.
Yes.
You have op-eds in a newspaper, for example, for that purpose, where somebody can come and share their opinion. But when you're raising information about facts, about things that happened, about occurrences, that is what it means. News, information from north, east, west, and south. That's what news is.
Why don't we take a look at several headlines, even as we conclude?
Yes.
Business Daily. Workers pay more to NSSF as regulator delays relief. Meaning there was relief, it has been delayed. Nation. Mexican cartel run drug lab in Kenya. They're reporting. They've gathered the data. They're reporting. We're looking at the Star. Only 4 million people paying for SHA. Non-salary members pay only when sick. That is the headline. Let's look at the Standard. Enemy of the press. Anyone who is considered to be at the forefront of curtailing freedoms that are enshrined in the Constitution, you will be an enemy of the Constitution, actually. And in this case, since it is directed at the press, you'll be an enemy of the press.
And as well, remember that the press, we speak to the people. We represent people's views. At that point, if you attack the media, then again, what are you telling to the people? Because then again, what we are doing, we are the mediators, ensuring that the public is informed, which is the right in the Constitution of the Republic.
And if we misrepresent the public in this country, they are quick to tell you that you misrepresent.
Even before the thing dries.
They will point it out to you and they will tell you in clear and uncertain terms.
Even before the ink dries on the even before it dries on the newsprint, you already get that information and you get it clear. So what do you do in a case whereby certain rights are being curtailed? Do you just continue telling the truth? I'd say you continue putting it out there. And let's see what happens as a result of that.
Kenya
certain pressures.
has rights and has enshrined and has permitted rights that very many African countries can't even think or dream of.
Yes.
We're saying, let's keep doing better.
I think finally, 100 years old, Standard is doing well, being bold. the only thing you can do is continue being bold.
This is the Situation Room, the only way to start your day.